never heard somebody say, gosh, I'm enjoying menopause.
In the hot flashes. No, but a lot of women over 50, will tell you that there are the night sweats, the mood swings, they hate them all.
Yeah, and on top of all of that, you may be surprised the next time you visit the dentist.
Of all places.
I know. Check this out.
And my bone density test this year showed that I had osteoporosis.
But that's not the only health problem that Cindy's having.
Once she started going through menopause, it was all at once.
Cindy Levtow also found herself in the dentist chair for more than just her usual checkup.
My tongue would be burning sometimes, and my mouth was very dry, and my gums were swollen.
So Cindy, how are you today?
So she headed to periodontist Dr. Greg Diamond for help.
Tell me what you've been doing at home since our last meeting.
The electric toothbrush, you told me, brushing gums, brushing my tongue.
Women, as they age, usually around year 51, there's a tendency or a potential to lose bone around teeth. And then there's a problem that usually occurs with women during the same time period, which are typical cardinal signs that we see in the mouth. Those include burning of the tongue, dryness of the mouth, loss of sensation of taste. Sometimes we see bleeding gums, enlarged gums, as well as women tend to become less sensitive to sugars, and they tend to eat more sugar, which leads to an increase in cavities.
He's given me a whole regimen of things to do to make sure it doesn't get any worse with the osteoporosis and the menopause.
What we basically do is address the dry mouth, because the dry mouth leads to cavities. So we have over-the-counter products that we can prescribe to them that they should be using on a daily basis. We also use tongue scrapers, because most of these people with dry mouths tend to have accumulation of bacteria on their tongue, which leads to bad breath. Each and every woman is different. What we always have recommended from day one is that patients come in to see the periodontist. They come in to be checked periodically.
Dr. Diamond also recommends the normal hygiene regimen of flossing, brushing with an electric toothbrush, and soothing mouth rinses that don't contain alcohol.
And if they're on that regular 3-month regimen, more often than not, they're somewhat controlled.